I've just been reading an article today that came out sometime last week that was talking about the fact that the ambulance service are now going to be asking people which pronouns they should use. And there is this usual moral panic that surrounds any kind of conversation about pronouns and somehow it becoming about trans identity, which is an important part. But the other important part of pronouns is respect, which is a fundamental part of any kind of healthcare interaction. For me, when somebody comes into the clinic, it's a case of saying, my name's Philippa, I use she, her pronouns, what's your name and how would you like to be addressed? That's what it comes down to. Which pronoun should I use? It's a simple question. We are not saying, I'm not going to treat you, I'm not going to provide chiropractic treatment to you until I know which pronouns you use. We're simply saying, hi, welcome, I'm your healthcare practitioner. I would like to know how to address you so that I can treat you with the utmost respect. It's as simple as that. And now, for me, as somebody who identifies as cisgender, so my gender identity matches the sex that I was assigned at birth, it takes nothing away from me to have she, her pronouns on my email signatures, on my LinkedIn, on my presentation slides and things like that. But for somebody who is perhaps gender non-binary or gender fluid, who uses a neo-pronoun, so who uses they, them, who uses zir, or whichever pronoun they use, when they see somebody like myself up there just using my pronouns, it immediately makes them realize that I know what a pronoun is, I know how important it is to be respectful of somebody's pronouns, and it creates a safe space for my patients as well, who do use neo-pronouns, to tell me what those pronouns are, and immediately we can start having more of an honest conversation. And as a healthcare practitioner, that's what I really want to get to the bottom of. I really want to understand the patient in front of me so that I can provide them with the very best care possible. So it doesn't have to be this enormous philosophical debate. It is simply, in many cases, just about being respectful to our patients, being inclusive and meeting their healthcare needs. So I find it almost laughable, the fact that the media like to spin these stories about trans identity and things like that, when fundamentally we're talking about respect of other human beings. It's not that hard. If you find it awkward, if you find it weird, if you've not got used to asking somebody about their pronouns, just practice it. Practice saying, hi, my name is X, I use X pronouns, what's your name, which pronouns should I use? It's really simple and it takes seconds to do, but we have to get comfortable with using it as part of our consultations. So practice, practice, practice.